productive citizens. Now, there's a lot of research throughout the world, including the World Health Organization, that addresses living conditions. Now, living conditions can include inside your home, the space inside your home, and the space outside your front and back door, and the living conditions in neighborhoods and communities, so they go together. We also know that the kinds of institutions that people have to support them. Religious and spiritual institutions, families or institutions, universities or institutions, recreational centers can be considered as institutions, and so can clubs and certain organizations that are significant to one's social well-being, which spills over, we now know, into their overall health status. And of course, we know that social and economic policies and politics guide and direct most of the determinants of our health. We also know that in order for people to have stable families and communities, there must be stable governments. From the World Health Organization, we've learned that why and how is it that we manage to treat people, nurses, physicians, epidemiologists. We work hard every day to treat people, but I don't think we give nearly enough emphasis to thinking about changing what makes people sick. So we treat people on the back end rather than addressing the issues on the front end. I think that happens all over the world, and I can say with quite a bit of definitive results that it certainly occurs here in Cleveland and other parts of the United States. Now let me tell my story using another model that is simply go on, yeah. Sorry about that. Here we're talking about the human life cycle. The human life cycle is basically the same all over the world. In health, in some components of health, we can speak a universal language. We have to be concerned about what happens before birth, the mother, the father's health, the environment within which they live, the birthing process, and that birthing process takes us through national socioeconomic environments, whatever they might be for you and me, may be different. But what is needed is the same. We must live in civil society so there can be respect for individuals, respect for the human body, the respect for life, and the respect for individuals to die a peaceful death. We must have social networks, and we must have health networks which are involved here in order for us to transverse through this life journey to a peaceful death where hopefully we would have had a long tenure in life. There's one more way that we can go about telling this story, and this is from the MacArthur Foundation. The MacArthur Foundation here in the United States gives about $500,000 to individuals who have made significant contributions to improving the human condition. So I thought I'd share this with you. The MacArthur Foundation makes the case that socioeconomic status will be one of the basic determinants of what happens to a person's life. And the socioeconomic determinants include one's education. And I'd like to say that all of us here at CASE and you at your university are indeed fortunate and elitist people because we've had an opportunity to get an education. Education determines occupation, and occupation determines income. And then we have who we think we are. That's the subjective socioeconomic status. We have some people who are members of long legacies of families who are significant. At least they think they are. And that gives them an advantage. And then we have the socioeconomic inequality. Those people who are smart, who are willing to work hard, but have never had that opportunity. And then we have gender. In the United States, we have the issue of race that has about 200 or 300 years of history. You know that, so I won't discuss it. But gender in America and all over the world is a major issue because women are not respected in all societies, to include here in America. There's evidence here in America that if you're a woman, you make about 77% of a dollar. If you're a man, you make about 100% of a dollar. And that has been going on in America since women started working. Women started working in mass during World War II. In this model is also suggest, as the other models have suggested, that your neighborhood can be an influence or constraint. If you have lots of friends, you have more opportunities. If you have more opportunities, chances are you're going to have better working situations that will provide you with more income that brings you back to socioeconomic status. Where your environment, where your family lives and who they know will help you with your social support. And if you are a woman or a minority in a particular society, minority by religion, minority by geography, or minority by ethnic group, you're going to have some trouble. That's the way the world has responded. Now let's take another look here at the physiological influences. If you have difficulties, depression, anxiety, if you're in hostile environments all the time, if you have negative expectations of yourself, negative expectations of you, if you perceive that you're not being treated well because you are a nurse and you're not respected on the unit when you work with other professionals, that's a problem. Nurses have that problem all over the world. And then how you respond to that lack of respect also will determine your long-term health. Now, we have this, and then we have all of these areas influencing health-related behaviors. We also have access to health care as an influence. And of course, exposure to carcinogens and pathogens. And in the United States and Egypt and other places in the world, we know that poor people are more likely to be exposed to pathogens and other kinds of substances that are detrimental to their health. Long term, we have exposure to the central nervous system and the endocrine system. And all of these areas here help to identify one's health outcomes. One's health from a physical, mental, cognitive position, the prevalence and incidence of disease, and then whether we will have recovery or whether we will have mortality, morbidity, or I could add longevity. Now, so I think you get the point here that I will summarize in a few words, and that is, in social and interpersonal environments affect health. The socio-economic conditions will determine your life course unless you help me and others to intervene and make a difference. That is through scholarships, through nurses teaching in communities, teaching people how to be healthy, helping children to develop their dreams and providing them supports to make them come true. The social environments, the social political institutions that nurses work in, that nurses support as citizens, and the psychosocial environments within which all of us live and work influence our health. Now, health is a state of complete physical, mental, and social well-being, and not the absence of disease or infirmity. Now, this is a statement from the World Health Organization. It was developed in about 1948. It has never changed, and it is as prevalent today as it was then. This is a very wonderful, healthy, looking, happy family. My question is, what is it that we as nurses, as healthcare providers, as citizens, as women, what is it that we can do to make all families have the opportunity to have a better chance at a different kind of life? And again, that's through education, that's through health care, improved health status, and improved interpersonal relationships where we can provide support and respect for all people. World Planning for Health for All is very simple. And I think it is a driving factor for all nursing programs in every university in the world. And that is to reduce the burden of excessive mortality and morbidity, to develop effective health systems, putting nurses in communities, nipping problems in the bud before they begin, and expanding the knowledge base of nurses, and also at the same time increasing their scope of practice. Now, how do we go about affecting community health? This is from Ping Lu, who is a scholar in health. He says the health of the community is the heart of the community. And we need to look at physical factors. What kind of industrial development occurs in communities? Do we allow sweatshops in our communities where women work for nothing all day? And there are hazards of fire, asbestos, etc. What about the civic environment? Is it safe? What about the geography? Is it safe to transfers? Does the geography, just simply where I live, provide some constraints for me? Do I live in a desert? Do I live in a remote rural area like a reservation here in America? There are 2 and 3 million acres of land, sparsely populated and no resources. Then we look at social cultural factors. What are the health beliefs, the traditions, and the prejudices that providers enter the clinical encounter with, or that patients and their families enter the clinical encounter with? How does economics, politics, religion influence how we treat patients and how patients respond to us? Does a patient's socioeconomic status make that much difference that we have to treat some patients, give them better care than others? Or are we talking about equal, equitable health care for all? What are the social norms at our hospital and our communities about people who are mentally ill? About individuals who have cognitive problems, cognitive delays? What are the social norms about people who are infirm, have disabilities, let's say the elderly? And how is our community organized to provide this health care? How do we get monies to educate nurses, to provide clinics, to provide hospitals where people can get service. And then, how is this connected to community volunteer programs or the individual characteristics and habits of individuals in the community? Now, when we look at the 10 top causes of death in Egypt, some of them certainly overlap with the 10 top causes of death in the United States. Worldwide, I'd like to add that the most common disorder across the world is depression. You did not have that listed from the World Health Organization, so it's not here. But coronary heart disease is a major killer in Egypt and in America, as is stroke, hypertension in Egypt and in America, diabetes mellitus, a major killer here and in Egypt. Low birth weight among some populations in America have not changed very much, and that also leads to high infant mortality, morbidity rates. And the United States ranks about 27th in the world. We have problems with this. Influenza and pneumonia are major killers for the elderly here, and it's one of the top 10 killers in Egypt. We have in Egypt also kidney disease and liver disease. With regard to kidney disease, you know that in America, a substantial number of individuals are on dialysis, and that's because of what we call end-stage kidney disease. It's very expensive to treat, and it's more prevalent among some populations than others. Highly prevalent among Hispanics, American Indians, and African Americans, and directly related to long histories of hypertension that has not been treated. And of course, in Egypt, there are eroded traffic accidents. We have our share in America, but it's not listed as one of our top 10. Now, what do we do about this as nurses and as healthcare providers? I suggest that we look at a model that you all know, but that we would need to strengthen, galvanize, and enforce. Here in America, as we go through our
Samira?
Okay, we're back up.
And this, I've gotten this from community medicine from Suez Canal University. I was happy to do that. I didn't find the date. But here in America, we are talking about training and educating community health workers, or neighborhood health workers, or navigators, or a variety of other names. But the idea is that the first level of contact between the community and the health system occurs in primary health care. It is essential to health. The majority of the prevailing health problems that we have can be managed, and many problems that you experience and we experience here in the United States can be prevented. We need to have individuals who are closest to the people in the community. And this in America, as we go forward with a bit of hope about affordable health care, will be provided through primary health care centers and what we are now in America calling health home. That is, everyone should have insurance and should have some place to go other than the emergency room when there's a healthcare need. Now, the secondary level is more complex health problems provided by district hospitals and also by specialty, the first level of referral. And this has been outlined by the World Health Organization, I think now for more than 30, perhaps 40 years. It works very well in countries that have this model. And of course, tertiary health care is where we have the specialist care. That's where most of nurses are trained. We call it acute care hospitals, we call it teaching hospitals, research hospitals. But the idea is to keep people out of the tertiary care facilities and keep them at levels 1 and 2, because that's where the prevention occurs. The individuals are not in crises, and the cost of the care is much less because the intervention has become much earlier. This is a World Health model that would function very well in almost any society in the world. Now, what does this have to do with nursing? Because my beloved colleague Sanab asked me to talk a bit about community health and public health nursing. And my response is that if we use a primary care model, recognizing the social determinants of health that I've shared with you today, education, social support systems, socioeconomic status, jobs for people, respect during the clinical encounter, then I think that nursing specialties and all of these levels and many more that you can think of need to be present in the community. They need to be present in community-based clinics and what we call health homes. They need to be based among those community health nurses who make home visits, who help mothers with their newborn babies, who can help the dying, the sick, the infirmed, the people who are at the end stage of their lives. And we must, throughout the world, get rid of our own stigma as mental health professionals and provide additional health care for individuals who are at risk for or who have mental illnesses. We now have data that schizophrenia, for an example, a horrible illness that strikes at about early adulthood, late adolescence and early adulthood, has 4 specific features. And if we are astute enough, we will be able to pick up those individuals at risk as young as 8 or 10 years of age or earlier, and provide them with support systems where they never would have to experience the florid symptoms that we call psychoses. I also think that in schools, nursery schools, elementary schools, colleges, universities, private schools, public schools, there must be a presence for health. I should have added to this slide occupation in places where people work, on buses where people are transported from place to place, information about healthcare. Community health nurses riding the bus and taking the microphone and giving a lecture as the people go from urban to rural, rural to urban. We must make it as common as drinking gasoline or buying a bottle of soda to drink, or buying a piece of candy. Healthcare for all people requires a constant involvement every day with addressing the healthcare needs of individuals. Throughout the world, we must advocate for clean water for all people. One of the quickest ways to contaminate and destroy a group of people is to contaminate their water. We also must advocate for better nutrition. Here with the new Affordable Care Act, all food substances must include the number of calories in a particular serving of chicken or greens or whatever, so that we can get our own obesity issues under control here. And of course, emergency health should be used for emergencies and not for chronic, not for managing chronic conditions, as they are here in America at the moment and other places throughout the world. In conclusion, all nursing specialists should have a presence in the communities. It is the only way we will make a difference. And I think Egyptian nurses are beautiful, and Egyptian nurses will make a substantial difference in the health status of people in Egypt, and their influence can be also impacted throughout the world. Thank you very much for this opportunity.
Thank you, Dr. Figuer.